Hello, everyone. Good evening, and you're most welcome to an academy learning platform. And you are with Dr. Rohini on the subject anatomy. And we are going to start with the mixed match today. Started with this series yesterday, and that was the first one where we are going to discuss a lot of questions, and these questions will have many sub questions or many options. So it is not like you choose from something, but it is going to be little different and little going to be more intense with the question. So this is mixed match 2. Let's see what we have for now today. So here is a little introduction about myself before we start with the actual topic. Uh, I'm an MD from Mangalore, KMC, that is belonging to the Manipal Academy of Higher Education. And this is a deemed university. It has two locations, Mangalore and Manipal. I studied at Mangalore, that is in Karnataka. And with this, I must bet that with this degree only, I was able to work for more than 9+ years in USA. And of course, I worked in the administrative section in the hospital, Rockingham Memorial Hospital, Harrisonburg, Virginia. And where I also have completed these two degrees, medical transcription and MBA from Georgia University. And I have also acquired PhD from Savitha University, Chennai, Tamil Nadu. So all this was done simultaneously. All right, so let's see. The first question. Okay, here we have, let's go to the question. Okay, the first question, passing through the greater sciatic foramen. You must have heard of greater sciatic foramen, lesser sciatic foramen, and all these things. Yesterday, we discussed some thoracic questions, thoracic region questions, and similarly, we are going to do all the sections in anatomy. So here is the question, passing through the greater sciatic foramen. What are these? Now here there is true or false. You need to pick the sentence or the word that could be true or false. Now here, is it superior gluteal vessels? Does that pass through greater sciatic foramen? Superior gluteal vessels. Okay, then there is inferior gluteal vessels, sciatic nerve, the nerve to quadratus femoris, tendon of obturator externus. So now, which one do you think is the answer? You can write down your answer. Let me just wait for 2 minutes so that people can give their answers. Those who are watching can definitely answer this. What are the structures passing through greater sciatic and lesser sciatic? Anyone? There is greater sciatic is divided by the piriformis muscle into upper and lower portions. So there is an upper portion and a lower portion. Upper portion definitely has the superior gluteal vessels and the lower portion has inferior gluteal vessel along with the sciatic. So let's see what are the things. This is true. This is also true. This is also true because we are considering both the upper and the lower portion or below the piriformis as well. Nerve to quadratus femoris, no. Tendon of obturator externus, no. So all these, no. So it is, I would say it is A, B, and C. The answer is A, B, and C. What do you think? It is A, B, and C. So these are the structures passing through the greater sciatic foramen. Let's see the picture. This is the piriformis muscle, which is one of the lateral rotator of the hip, along with the 5 other muscles. So that is piriformis. And you can see the structures above superior gluteal artery and the nerve. This is such a cute, diagram with not too much of information, but it is just apt. And whatever is required is there. You also can see the gluteus maximus, And you can also see minimus and the medius. And one thing that you can notice is superior gluteal vessels run between the medius and minimus. So what does that mean? There is a, catch. In anatomy, if there is any nerve passes between the two muscles, it has to supply those two muscles. So here this one runs between these two. So obviously it will end up supplying the superior gluteal nerve, obviously supplies the medius and the minimus. And what is the action of these two? The action of these two is abduction. And what is the action of the maximus? The maximus is extension. It's a powerful extensor of the hip joint. Extension. Okay, remember this. So here is the structure below the piriformis. You can see inferior gluteal vessels and nerve. You also can see sciatic nerve, very important. It is below the piriformis, along with whom? The inferior vessels. Okay, so now that is what we picked. All right, we picked sciatic, we picked all this, and obturators, the obturator internus, all that is with the lesser sciatic. All right, next, the superior, the gluteus maximus muscle. The gluteus maximus muscle rotates the hip laterally. Does it rotate the hip laterally? It covers the ischial tuberosity when standing. Does it cover the ischial tuberosity when standing? Extends the hip joint. Is supplied by L5, S1, S2 roots. It is inserted more into the iliotibial tract than the femur. All right, let's go look at some information about the gluteus maximus and then we'll come back to this. So here is the gluteus maximus. You can see it is inserted into the iliotibial tract. So this is the iliotibial tract. And it is formed by this tiny muscle that is called tensor fasciae lata. And this is the gluteus maximus. So those two together give rise to this iliotibial tract, and you can see it is on the lateral condyle of the tibia. It is inserted into tibia. So you can see that. And what is the action, origin, insertion? Let's see. This is from the ilium, the origin, and it also, you can see that it covers the ischium. While standing, it definitely covers the ischium. That was a question there. And there was more other statement. We'll go back to that. Insertion is on the iliotibial tract and also into the gluteal tuberosity on the posterior surface of the femur. So it has both insertions, but more insertion is on the iliotibial tract. And action is extension and L5, S1, S2. Inferior gluteal nerve supplies that L5, S1, S2. So let's see this. Go back. So the first one is rotates the hip laterally. It does not take part in rotation of the hip. Covers the ischial tuberosity when standing. Yes, it does cover because all the structures are underneath. There are various structures. Many structures are underneath. So this is again a true thing. It covers. It extends the hip joint. Yes, it is a powerful extensor of the hip joint. And it's supplied by the inferior gluteal nerve. So that is the root value. And you can see that L5, S1, S2, lumbosacral plexus. Then you have the inserted more into the iliotibial tract than the femur. I said yes to this because we just saw the picture and this is the answer. So except this one, all other are correct. So it is B, C, D, E are the right answer. Rest, that is only one that is false, rotates the hip laterally. I told you the rotation of the lateral rotation of the hip is done by piriformis and other 5 muscles. So that is gluteus maximus for you. Let's move to the third one, the long saphenous vein. The long saphenous vein is also called the great saphenous vein. And this is from the medial side actually. So remember G for great toe. Great toe, you remember. It is on the medial side. This is all for quick learning and quick thinking and quick recall. That is what we need, right? At the end of the day, quick recall is what we need. And whatever your method is to recall, whether it is mnemonic, whether it is the image or something silly like this, also should work for you. So quick recalling is what we need. So if that gives you a quick recall, go ahead with it. So long saphenous vein has valves only in its lower part, lower half, and it drains into the femoral vein. It has connecting veins to deep saphenous system, deep venous system. It's a continuation of the posterior tibial vein. It passes a hand's breadth posterior-medial to the patella. Let's look at the information first. Great saphenous vein is this one. It is on the medial side, as you can see. It runs from the dorsal venous arch. Near the great toe it starts, or the large toe, and from the first digit you can see that it merges with the dorsal venous arch of the foot, and then it passes anterior to the medial malleolus in front of it. Remember, not behind, in front of it. Behind is already behind there is the, on the lateral side we have fibrillaris, two tendons, longus and brevis. On the medial side, we don't have anything, but still the great saphenous vein runs in front of the malleolus. And at the knee, it runs over the posterior border of the medial epicondyle of the femur. And then it crosses laterally to lie on the anterior surface of the thigh before it enters the fascia lata opening. There is an opening in the fascia lata that is called saphenous opening. Remember the saphenous opening? Last week we talked about the femoral hernia. Okay, we talked about femoral hernia and the saphenous opening. So this saphenous opening is in the fascia lata. And then it joins with the other femoral vein in the region of the femoral triangle at saphenofemoral junction. So now where is it? Near the knee. It runs over the posterior border of medial epicondyle of femur. Remember, it is near the medial epicondyle of femur. All right. So remember this. All right, let's go back and see. It has valves only in its lower half. That's also correct. It drains into the femoral vein. That's correct. Has connecting veins to the deeper venous system. Right? It's a continuation of the posterior tibial vein. It's not a continuation. And that because that drains into this, not a continuation. Passes a hand's breadth posterior-medial to the patella. Posterior-medial to the patella. All right. So these are the answers. A, B, C, and E are correct. Next. In the lower limb, venous return is mainly dependent on the gravity in the lower limb. It's not mainly dependent on the gravity. It also is dependent on the competency of the valves. So this is false. Venous blood flow is from deep to superficial or superficial to deep. It is from the superficial to deep. So this is also false. The perforating veins are mostly around the knee. It's not knee, it is near the leg, below the knee. Valves play an essential role in venous return. True, it is very true. The muscle pump is aided, the muscles being surrounded by thick fascia. Not all the muscles are surrounded by very thick fascia. It's only the thigh region that is surrounded by thick fascia. And this is the one, the answer D. This is the only one which is completely agreeable and right. So this is how it looks. You can see the saphenofemoral junction where you can see the saphenous vein, that is the great saphenous vein is joining the femoral vein. And here is the fascia lata, that is fascia lata has an opening, saphenous opening, and it opens into the fascia lata, and the great saphenous vein passes through it. And you can also see those perforating veins that is near the leg. It is not near the knee. And then you can also see the arch, medial dorsal venous arch you can see. And in the other picture, you can see small saphenous vein draining into the popliteal vein. That is the saphenopopliteal junction. Okay, let's move to the next one. So the next one has the question passing through the great sciatic foramen. Passing through the great sciatic foramen. Tell me what are the structures? What passes through the greater sciatic foramen? Now this is the same thing, but there is a twist in the question. They have asked even if the muscle is a part of greater sciatic foramen. Of course it is a part of. So it is piriformis. Obturator internus that comes under lesser sciatic. Inferior gluteal, yes. Greater sciatic. Superior gluteal, yes. Pure posterior cutaneous nerve of the thigh, that is not part of this greater sciatic. Posterior cutaneous nerve of the thigh, no, false. So these are the answers, that is A, C, D are the answers that you can pick, the structures passing through greater sciatic foramen. Okay, so now here you can see all these structures. There is the piriformis which divides this greater sciatic into upper portion and a lower portion. The lower portion below the piriformis has this mnemonic you can use, I pin spin. So you can see the inferior gluteal nerve. You can see the pudendal, inferior. All these are the structures below the piriformis. All right. So now here pairs of the muscles that are supplied by same name nerve include. So the ones which have got the same nerve supply. What about tibialis anterior and posterior? Tibialis anterior and tibialis posterior. Anterior belongs to the anterior compartment. Posterior compartment is completely different. So these two no. Fibularis longus and tertius. This one is from the anterior compartment and this one is from the lateral compartment. So no. It always depends on which compartment muscle it belongs to. Short and long heads of the biceps. There is a short head and a long head. The short head belongs to hamstrings actually. And there is a long head also, which actually, that is, there is a short head and long head of the biceps femoris. We'll talk about this one. And semimembranosus and long head of biceps femoris. What about semimembranosus and long head of biceps femoris? Gracilis and sartorius. Gracilis belongs to adductor compartment and sartorius belongs to the extensor compartment or anterior compartment. Semimembranosus, semitendinosus and biceps femoris are all of the same hamstring group. Okay, so this is the right answer. All the others are wrong. So you have to pick the D as the answer. When it comes to the biceps femoris, is supplied by the terminal branches of the sciatic nerve. You know that. The terminal branches are the tibial and the common peroneal because that is exactly where the biceps divides into two portions. That is exactly where you'll see the sciatic also dividing into tibial and common peroneal. So here, even though it has got the same spinal root value, it has two heads. That is, biceps has two heads. When both the heads receive different nerves, that is, the long head from the tibial and the short head is supplied by common peroneal division. So this is something that you need to keep in mind. Long head, tibial, short head, common peroneal. Next one. Regarding the joints of the lower limb, there are so many joints. There is hip joint, ankle joint, knee joint. These are some of the main joints, and there are so many small joints also in the pelvis. Let's look at the different other questions we have or statements we have. The ankle allows a little inversion eversion. Where does inversion eversion take place? This happens at the subtalar joint. Let's correct this. This happens at subtalar joint, not at the ankle joint. So this is the false answer. Next one, the knee locks by rotating the femur laterally. That is correct. But you should also remember tibia rotates medially. Okay. The close fit of the femoral head into the acetabulum. What does it contribute to? The stability of the hip joint, close fit of the femoral head in the acetabulum. Yes. Stability of the hip joint also depends on the fulcrum. It's called the fulcrum. Medial rotation of the hip is performed by the gluteus medius and the minimus. Which one produces the medial rotation of the hip joint? And what are these actually? These are abductors. They don't produce any medial rotation. So this is not the correct answer. Next one, the flexion of the knee joint is performed by. The flexion of the knee joint is performed by. The ones which are at the back, not the quadriceps. That is a part of the lateral rotator. So the flexion of the knee joint is by the hamstrings. This is also wrong. So we have 1 and 2. So there is B and C which are correct. Next one. The adductor tubercle. The adductor tubercle. Have you heard of this adductor tubercle? Adductor tubercle itself gives you a hint that it is the giving attachment to one of the adductors. There is magnus, longus and brevis. So which adductor? It is related to junction of the femoral and popliteal arteries, the adductor tubercle, the femoral and popliteal arteries. Femoral artery continues as popliteal artery at the junction. Yes. Next one, it gives attachment to medial meniscus of the knee. No, not this one. It is not giving attachment to the menisci. Is on the upper aspect of the tibia. This is correct. It gives origin to poplatus. No. Gives attachment to tendon of adductor magnus. Yes. So the answer is A, C and E. A, C, E. Okay. So that is the answer. So please look at all these things, options again and again. And I don't know, you can call this as different statements because it's with one single keyword, we can get so many questions. That's what I'm trying to discuss here. Just with one keyword like adductor tubercle, you can frame so many questions. And all these questions are equally important, and it will make you think, and it will also give you a good assessment of how much you know about one single thing. Next, the adductor magnus is what? It is a triangular muscle actually. Where is it situated? On the medial side of the thigh, because it is an adductor. And then it consists of two parts. It has got a embryonic origin. That's the reason it has two parts, and innervation is also kind of different. It has a action, the ischiocondylar portion it has, that is a hamstring portion, and it is considered to be part of the hamstring group of muscles. Okay, ischiocondylar portion. So remember, this adductor magnus has got this ischiocondylar portion, and that is considered to be part of the hamstring group of muscle. Otherwise, this muscle is supplied by obturator nerve, and that portion is also supplied by the common peroneal nerve. Next one, the profunda femoris. Profunda, whenever you hear this, you remember it. We're talking about the deep branch. Okay, it anastomoses with the inferior gluteal artery. Inferior gluteal artery. It has branches that supply the ankle region. It can be distinguished from the femoral artery in an arteriogram because of its many branches. Of course, profunda femoris. And then it's a branch of first perforating artery, supplies the thigh muscles. Now, what is the right answer? Profunda femoris. It anastomoses with the inferior gluteal artery. Does it anastomose with the inferior gluteal? Yes, because it forms trochanteric anastomosis. It takes part in trochanteric anastomosis. That's why. And then it has branches that supply the ankle region. No, it does not go up to the ankle region as such. So it is false. And it can be distinguished from the femoral artery in angiogram. Definitely it can be because of its many branches, because of the lot of perforating branches. It has 4 perforating branches, and the fourth one is the actual, continuation. It is a branch of first perforating artery. False. It supplies the thigh muscles. It supplies the thigh muscles, of course. It also supplies the back of the thigh muscles. So here you can call this as true. Right, femoral artery and profunda femoris. It supplies the thigh muscles. When we talk about thigh, is it the front of the thigh, back of the thigh is not mentioned. So you can tick it as true. So now next one, last one, the quadriceps femoris. Quadriceps femoris, where is this? Just think, quadriceps femoris. It keeps the patella from dislocating laterally with the medius vastus medialis. Yes, vastus medialis will definitely, paralysis of this will definitely pull the patella. So you should remember the answer is true. Arises entirely from the femur, quadriceps femoris. Not entirely from the femur. It's also arising from the hip bone. So it is false. It is inserted via the patella into the tibial tubercle. Correct. This is true. It is a main extensor of the knee joint. Correct. It is supplied jointly by the femoral and obturator nerves. No, both of them don't. So now here, this is the one. Yes, this one does, but not that. So this is wrong. So the answer would be A, C, D. So remember, A, C, D are the correct statements. Is supplied jointly by the femoral and obturator. Obturator won't come into picture at all. So it is the wrong statement. Let's see. Okay, so that was the last question I could discuss with you. So here is some profile and dedications from my students. As you can see, that the profile picture looks like this, and please follow when you happen to find or bump into the profile picture and my profile. Please follow me, and you follow and you get notifications of all my classes that I'm going to hold. And you can also join the Telegram channel, that is Anatomy with Dr. Rohini. And you can also post questions, that you have questions against my class or any other thing that you want to. Or I also start putting up so many MCQs and other interactive questions and on the spot diagnosis. Try to do all that till your exam, so that your mind is active and you are dedicating the complete focus onto your exams. So here are some of the dedications from my students, where the students have earned a lot of hands because of their dedicated time to Unacademy videos, learning education videos. And here we have orange hat, yellow hat. All these are earned by the students and dedicated to the educators. And you can also see the Telegram channel, Let's Crack NEET PG. You can join this to get the PDF of all other educators as well. And you can also see Iconic and Plus subscriptions we have, and both of them are equally good. The Plus will have Unacademy access. Iconic will have both Unacademy as well as PrepLadder. And you can also ask a doubt. You can clip and send it across so that we can answer your queries. And you can also see there are special classes that are coming up very soon. In a few days, you have special classes starting. And the next month is going to bring lot of MCQs, lot of questionnaires, and I'm planning to have a lot of PYQ sessions and also the image-based questions and some MCQs. All this is just for you to reach your goal in time and right on time. And there is special class features that you can see. Interactive live classes is what is the thing that we have in special class features, because YouTube is not that interactive as special classes, and you must download the app and see it yourself. Only then you can appreciate the features of special class. And there are so many other features like polls we can use, and raise a hand feature is there. You can get notifications prior to the class, and also the PDF is collected at the end of the class. That is the thing that any student would want, right? Whatever the PDF that we use for the class is always got in the form of notes for you, and only that can happen if you have an app. So please download the Unacademy Learners app. And when you do that, it will ask you for a code. Use the code ROHINI10, and using this, you will be immediately able to be a learner at Unacademy, and you will get notification for the classes, and you can also download the PDF notes, and you can access it anytime with any kind of smartphone, or you can use the laptop, or you can even use the tab. So no restrictions on that. And these are the steps to subscription. And you can also see, if your goal is NEET PG, you can go to that and check out the different options you have with the money, with the number of months subscription, and then go for the subscription completion. You can also see there is Unacademy Learners app, which can be installed using Google Play or App Store. And if there is any content that you find it very inappropriate, you can also report it. So this is subscribe, like, and share. Please do that with all your friends. You can also send it to all your friends and relatives, and let them also see what we have at Unacademy Learners platform. And also don't forget to download the PDF notes. And this is the referral code. You can see ROHINI10. And this is the discount you can get with the code. When you use the code, it's not just for the free stuff. You can also get it get a 10% discount on your subscriptions. And here you can see the plus subscription, iconic, and also batches starting on 18th of August, you can see. And NEET PG 1 month package. All this you can get. And there is 25,000 plus high yield clinical based questions that you can access when you have a subscription. And this is something that is interesting, 12 plus 2. When you have 12 months subscription, you can also get 2 months free. And with this 12-month subscription, you can also get a hard copy of the, the notes that we use. So all that will be really, really, a bonus or interesting. And I would urge each and everyone who is still in UG to go have a look at what our 4 year subscription plan is, because this is going to give you a thorough and in depth, coverage of all those things that you're looking for, not just in UG, but also with the long term vision. If you go for, you can also be trained for your PG entrance exams. So your basics will be very straight and nice, and you will also know exactly, what points you need to focus on towards your PG. And all this not only helps you with UG, but also later on with your PG. So all that is just for 60,000, and that has 4 year subscription access. And also you have 75,000 for iconic subscription. And you can also see there is EMI option, the 1250, 1406. So these are some of the EMI options we have with the 48 months subscription. For this, we need at least 6 months of subscription minimum. So this can be accessed with the code ROHINI10. So use this code and then you see the magic. Here is the grand test series that we have that is scheduled from 4th it started, goes on till 11th. So it starts from 9 a.m. till 12:30. So this is going to kind of imitate the exact latest pattern that you have. So it started on the 4th till 11th of September. So it's going to be really nice with all the test series and dates are announced. And this is a really, really an informative, and a good assessment, because you also get the video clarifications for all those questions that you have answered. And all this is it for tonight. And then you are going to be all set with the next month series in the coming September. But before that, I'm going to have some more image based and some more MCQs to do with you. And I look forward to seeing you tomorrow at 10 a.m. with the grand MCQs. And that is with the plus classes. Those who have taken subscription can have this. And I also have, okay, no, 10 a.m. is not plus. It is the YouTube. This is YouTube. And this is going to be 10 a.m. is actually going to be an MCQ session. And it's going to be really interesting. And then we also have in the evening, 7 to 8 p.m. And that's going to be gray matter of brain. Okay, so this is going to be on plus. So kindly join. Whoever has a subscription can definitely access this. And we also have again 10 p.m. session, and that is going to be again one session of mix and match 3. So that is mix match 3. So I'll see you at all the 3 sessions. And you all have a good night, and thanks for being wonderful listeners and viewers.